The Presidential Task Force on COVID-19 has advised schools to send any pupil with respiratory symptoms consistent with the coronavirus home to reduce risk of transmission. National Coordinator of Presidential Task Force on COVID-19, Dr. Sani Aliyu, gave the advice at the COVID-19 national briefing in Abuja. The coordinator had some reservations about the compulsory tests for international travelers.
Any student presenting with symptoms consistent with COVID-19, particularly respiratory symptoms or fever, should not be allowed to come to school. And where teachers notice a child having respiratory symptoms, that child should be excluded and sent back home so that we can reduce the risk of transmission. Just as important is the need to communicate effectively with parents, staff, and school health teams, creating protocols and providing regular updates on any changes to the school procedures as it relates to COVID. We encourage schools to continue to consider creative solutions to abide by our COVID guidelines, including possibly the use of outdoor learning, staggered attendance to avoid overcrowding of classes, the use of what we call platooning, or where you have groups of children that are kept together and they do not mix, alternate day attendance of students, and adjusting teaching delivery. I wanted to again raise the issue of travel, international travel. As we are aware, we are approaching a very busy season where we see a surge in passenger traffic. The aim over the next few weeks by the PTF is to discourage travel, especially non-essential travel. We want to flatten that surge in passenger traffic that we see every year around December. Why? Because of COVID-19. COVID has changed the world. It has changed the way we interact with each other. It has changed the way we deliver some of our core services, and it has to change the way we travel as well. We are actively discouraging non-essential travel. Now, you may ask, what is essential travel? Essential travel is if you have to travel for study, work purposes, health reasons, humanitarian, traveling in order to support critical infrastructure, economic services, and maintaining supply chain arrangements. Outside this, if you do not need to travel, please stay where you are. If you are in Nigeria, stay in Nigeria over this period. If you are outside the country, please stay where you are. At the moment, we know that a lot of travel restrictions are going on across the globe. We are monitoring the situation very carefully in Europe, North America, South America, and the Indian subcontinent. If numbers continue to increase and we notice an increased risk of importation of infections, we will review our policy. Now, I'm not saying we will ban flights, but I am also saying that we will consider everything necessary to protect our country from a surge. So if you do not want to get stranded, whether it's in Nigeria or outside the country, think again about traveling over this period. If it is not essential, stay put. There will be other seasons, there will be other celebrations, there will be other years hopefully to come. But especially with vaccines now becoming available, across the board, it's very likely that travel will be sorted and all the inconveniences of testing and monitoring, etc., will go away. Once we have vaccines that are effective, I am very sure that the travel community will start imposing rules with regards to the need for vaccination. And once you are vaccinated, you have 2 vaccines, it's very unlikely that there will be restrictions. So all these inconveniences are for a short period of time. They are for a short period of time. In terms of the assurance we want to give the country, we continue to monitor the situation outside the country very closely. Nigeria has one of the most strict systems in terms of double testing. You have to do a PCR test not more than 5 days before boarding for Nigeria, and you have to repeat the test at day 7. We have been doing this for a large number of passengers, as explained by the chairman earlier on, but 60% of people paying do not even turn up at day 7. 60%. You give out your money, you pay for a service, and you don't even ask for the service. So we are not interested in the money. Nothing comes to the PTF, nothing comes to NCDC, nothing comes to any federal parastatal if you pay for the test. The money goes to the laboratories, and a small percentage goes to state governments as well as the banks that run the portal. So we're not interested in your money. What we are interested in is your status for COVID-19 when you come into the country. Do you have COVID-19? If you do, we have to take measures to isolate you, and we have to make sure that we protect our public health. If you don't have COVID-19, you exit from quarantine at day 7. Simple. We are going to enforce these over the coming days. We have now got a list of 300, the first 300 passengers that have not done the test up to day 14. We are going to streamline these results, and we will create a COVID-19 travel restriction list for passengers that have not abided by our protocol. And these passengers will not be allowed to fly for a period of 6 months.